My name is Farida Roy. I'm a nurse practitioner in acute pain service, and I'm going to talk today about pain management after your surgery. In addition to oral and patient-controlled analgesia, PCA, you may be a candidate to receive a nerve block to manage your pain after the surgery. A nerve block is when we use freezing medicine to numb your surgical area so that you have no pain or less pain for 12 to 24 hours. The anesthesiologist will discuss this option in depth with you before your surgery. In addition to the pain management medicines, we want you to use ice packs after your surgery. You're more than welcome to ask your nurse to provide you with an ice pack. We want you to make sure that you're not using ice packs more than 10 to 15 minutes on each painful or swollen areas. You can use ice packs as many times as you want, but please make sure that you're not using on top of the dressing. After surgery, your anesthesiologist and nurse practitioner will be visiting you to make sure that you are comfortable and to ask you, how is your pain? They're going to guide you and educate you how to manage and take your pain medications, and you will have an opportunity to ask any questions that you may have. They will be also providing instructions how to take medications at home as well. In order to achieve appropriate pain control, pain medications will be carefully selected using evidence-informed practice. Your pain will get better by using pain medications and ice packs. If you have any questions or concerns, please ask your team.